Wonderful. Hello. Hi, everyone. Thank you so much for joining us today here at Kusudi International. My name is Temi Ajibade. I am an advanced practice nurse anesthetist, and today I'll be talking about knowing the side effects of your medications, how to avoid personal harm and deadly cocktails that can impact you negatively. So let's begin. Next. The objective of today's meeting is to inform the community of the most likely and deadly medication interactions. Drug interactions can have serious consequences. Consumers of medications, supplements, and herbs should understand that we should always share our medication intake with our healthcare providers. It allows them to provide us with the best plan of care, knowledge, and ways to manage what we put into our bodies and how we take care of ourselves. Next. Let's start with understanding what medication is, the actual definition. Medication or medicine is compounds or preparations used in the treatment of prevention of diseases. We all take something in some form. A lot of us will take supplements or herbs. Other of us who suffer from chronic conditions like hypertension, high cholesterol will take actual prepared compounds to help us manage these diseases. The purpose of medicine is to promote health and to heal and treat diseases like I've mentioned. Next. First things first. We often will pick up our medications or anything that we're taking to help us stay in our optimal health, and we'll read the label. With our prescription medications, it's very important to take them as prescribed. Whether we know it or not, there has been enough research and studies on our medications to help us understand if we need to take it twice a day, once a day. And we are very personally responsible to following those directions. That is one of the first steps in making sure that we are not on a path to harm ourselves or to have any drug interactions that we would not want. Always inform your pharmacist or other healthcare provider of the prescriptions and non-prescription medications that you may be taking. Not doing so can have some serious consequences, as we are discussing now. Next. What are drug interactions? A drug interaction is a situation in which a substance, usually another drug, affects the activity of a drug when both are administered together. A drug-plant interaction, herb or organic compound. What is a drug-food interaction? A drug-food interaction happens when the food you eat affects the ingredients in a medicine you're taking, so the medicine cannot work the way it should. Drug-food interactions can happen with both prescription and over-the-counter medicines, including antacids, vitamins, and iron pills. Oh. What happens to the body? In short, you have synergistic and non-synergistic effects. A synergistic effect is causing an increase or excessive efficacy of the medication. So in essence, the medicine works too well, so you can have effects that just put the body into not a great state because the medication is working too well. A non-synergistic effect is a decreased efficacy of the medication. These things can happen with when two drugs are combined, when drug and food is combined, when a drug and a supplement is combined, or just as a result of your medical condition. Next. Common drug interactions. So a lot of times we all take medications that, we'll all take a medication just to get rid of a headache or to cure like a bacterial infection, or even just to keep our bloodstream and coronaries flowing at an ideal thickness and speed. So a part of that requires that we know some very common over-the-counter drugs or things that are taken on a regular basis. Sorry, and then I just wanted to zoom in on my screen so I can show you and talk some more about some of these drugs. So one of the more common interactions is taking Tylenol and antibiotics. So taking Tylenol with antibiotics may cause an interaction in the liver process, can cause your liver to go into overdrive or cause some damage with your liver. So you want to always know that if you're taking antibiotics with your Tylenol, you don't want to go too heavy on the Tylenol, and you definitely want to take the antibiotics the full course as prescribed. Another common drug interaction is aspirin and diabetes medication. The aspirin increases the blood sugar lowering effects of the diabetes medications. So you just want to be careful with that. Talk to your pharmacist. They'll make sure that you're on an appropriate dosage, as your doctor will also make sure. So it's for so often you'll go to the pharmacy and pick up your medicine, and if you use a different pharmacy, they won't know everything because they kind of at times use different EMRs. They do have a national prescription system where they're trying to integrate it in between states, but each state pharmacist is able to look at your prescription history and see what has been prescribed to you throughout the state. So they'll be able to do that, but it's definitely safer to use the same pharmacy when using these medications so they can catch a common drug interaction like this. Another thing would be Benadryl and sleeping aids. They can cause dangerous, severe central nervous system problems. They can basically potentiate each other and make sedation worse, make you especially tired, and cause you to not make the best decisions. Anticoagulants and vitamin K is another common drug interaction. Vitamin K can produce a clotting substances that can negate the effects of your medications. Another common drug interaction that we try to avoid, antidepressants and St. John wort. That's a herbal supplement. It can cause serotonin syndrome, which includes diarrhea and delirium and more. Birth control and antibiotics, they may reduce the efficacy of, that combination can reduce the efficacy of birth control if you are taking antibiotics. Use a secondary method of pregnancy prevention if you tend to have to take those two together or when you have to take those together. Another interaction would be cholesterol medications and grapefruit. Together they can cause kidney damage and weaken muscle fibers. So we want to be careful if chronically ingesting grapefruit and taking some cholesterol medications. And asthma medications and coffee, they can dangerously elevate the heart rate and blood pressure. Lastly, blood pressure meds and licorice. If you love licorice, you have to be careful. It can result in hypersensitivity to a hormone in the adrenal cortex. As a general rule, avoid drug interactions whenever possible. Never take medications with alcohol. Always ask your pharmacist about interactions. They should be well informed enough to tell you and advise you, and you can make the best decisions and establish best practices. Never combine medications without a doctor's order. In a world where we are adding supplements to our daily regimen, we definitely want to do our research. So the pharmacists are a really great bet in understanding how supplements may help us. Do not assume natural products are safe. Take medicine only with water, and always read your warning labels. Next.
Ms. Ajibade, I have a quick question. This is Nia here.
Yes.
What happens if you get diagnosed an anticoagulant or, let's say, cholesterol medicine from 2 different doctors, or let's say blood pressure medicine and okay, let's say you have allergies, you have to take Benadryl, and you get sleeping aids from another doctor. How do you decrease that drug interaction or help make sure that you don't have a bad drug interaction when you get prescriptions from different doctors?
The key with that, and I know I've said it a few different times, is one of the best ways that you can do that is by using the same pharmacy location, because, and ask, the pharmacy will ask you if you're taking any other sleeping aids, and you'd have to know that Benadryl, you might be taking it for your allergies, but you know that there's a warning on the box of the Benadryl that says, may cause drowsiness. So if you read all your labels, and when you go and you use the same pharmacist, and when they ask you if you have any questions, you can say, yes, what shouldn't I be taking? Or what could make my sleeping aid, too powerful or too strong? And one of the things they will tell you, they will ask, what are you taking? And you can tell them Benadryl, or sometimes it might be like a NyQuil, which has Benadryl in it. So different names, but be specific. They'll know what's in the medicine. And they'll tell you that you probably shouldn't be taking it. So when they ask you what you're taking, be honest, be mindful, be clear and specific, so that they can give you the best information. They will tell you things like not to take the Benadryl, or to take the Benadryl at different times of the day, or only if your allergies are in overdrive. They may suggest a different antihistamine that doesn't have a drowsy effect, so that it wouldn't potentiate your sleeping aid. So it is clear to basically keep your prescription dispensary very streamlined. I think that that's key. Even if you're going to see different healthcare providers from different specialties, that's a way to narrow it down and stay safe. Did I answer your question?
Yes, thank you.
Any other questions about these common drug interactions? Okay. Next.
I had a question about Tylenol and antibiotics.
Okay.
Usually doctors don't say anything about that anything's wrong with taking Tylenol with an antibiotic. So I'm surprised that you listed that. What should we be concerned about?
The major concern with the Tylenol and the antibiotics is basically liver processing. So the concern is mostly putting the liver in overdrive, and that's with chronic use. And they're more heavily talking about the Tylenol's effect on the liver, and making sure you take it as prescribed. So sometimes people might take more than the daily recommended dosage of the Tylenol, and in conjunction with your antibiotics, that could cause the problem. And we're talking about more heavy duty antibiotics when we speak about that, not necessarily the penicillins, but more like the vancomycins and other heavily drugs that are cleared through your liver. So that is why that has made the list for a common interaction, and why it's important to talk to somebody who really understands how the drugs are processed and cleared.
Mm-hmm. So what is the daily recommended dosage? Like if you have a migraine headache all day and it's not, you haven't solved the problem by 4 o'clock, and I mean, what is the dosage of Tylenol that you should not go over in one day in milligrams?
The major daily dose for Tylenol is you don't want to take more than, I want to say, 5 tablets, which is usually, Tylenol is usually 600 milligrams a day. So you're up to 4 grams a day. So you don't want to take more than 1 gram, 1 gram every 4 hours and 4 grams a day. That would put your liver into a very unsafe state and can cause it to an acute issue or shut down permanently.
Oh, I see. Okay. Thank you.
You're very welcome. The most dangerous drug combinations. A lot of us are always told not to mix alcohol and medications, but there are some medications that are absolute no-nos, and you really put yourself in a dangerous position to make bad decisions or to have an accident. One such combination or cocktail is alcohol with opiates. An example of some opiates would be OxyContin, Percocet, or Vicodin. If you've ever had surgery or needed to be treated for pain of any kind, a doctor may have prescribed OxyContin, Percocet, or Vicodin for a dental pain, a back pain, or an injury. And taking alcohol with the opiates will just potentiate a sedative effect and possibly end your life if you do it in an excessive amount. So it's best to avoid alcohol when taking any pain controlling substances in the opiate category. Another combination that you're advised to stay away from, again, for a potentiation effect, a worsening effect of sedation, respiratory depression, and things like that, are alcohol and benzodiazepines. An example of benzodiazepines are Ativan, Valium, and Xanax. So those benzodiazepines are used to treat your anxiety, or as is commonly referred to, nervous disorders. And often alcohol will be consumed to lessen anxiety as well, or to relieve your stress. So people are very often tempted to take these things together, not really correlating that they are putting themselves into a very vulnerable state physically. So it's always best to not mix your alcohol with any anti-anxiety medications. And another cocktail, cocaine and heroin. Cocaine is only legal in the operating room setting use. Otherwise, it is illegal to consume or use, as well as heroin. However, we know that, people do abuse these drugs, and the best practices, if you are going to or you are suffering from addiction, you should seek help. And if you can't control the help and you can't get the help, try not to abuse multiple drugs at once, because cocaine and heroin can be a deadly mix and you can die. And again, alcohol and cocaine will potentiate each other and can cause cardiac arrhythmias, cardiac depression, and heart attack, seizure, stroke, or death. Next.
Quick question, Ms. Ajibade. Why would they use cocaine in the operating room? Like, what purpose does it serve during surgery or procedure?
Great question. Well, cocaine is actually a local anesthetic. So, especially when working on the nose or the membranes of the nose, you apply cocaine to the area and it will numb the area and allow a surgery or a procedure to be performed with less pain. But it also has the ability to allow you to be high. So it speeds up your system and it gets you going, and you experience an extreme euphoria from the way that it speeds up your system. So it will give you a numbing effect, but also it can cause you to become addicted to the euphoria and the stimulation that it provides. Medical conditions that increase the chances of dangerous drug interactions. So some common conditions that we know people to suffer from is kidney damage, end-stage renal disease. That's a permanent form of kidney damage. So there are a lot of medications that are cleared through the kidney, and if it doesn't work at an optimal rate, it will leave a great amount of free drug in your system, which can do, depending on the drug, cause excessive effects of the medication on your body, and in essence, leave you vulnerable. HIV/AIDS, immunocompromised patients, they tend to use drugs that are heavily processed through the liver, so they can really develop a degree of liver insufficiency, and the drugs not be cleared appropriately through the liver, and again leave you vulnerable for an excessive effect of the medication. Some types of liver diseases can also have the same effect, and poor nutrition. Any questions about medical conditions, or any questions about any current medical conditions that you may be taking medications for that could be affecting your medication, or any drug interactions that you may be concerned about?
I'd like to ask a question. This is Mary contacting you from New York City. I wanted to inquire about medication in terms of advocating for yourself. There's a lot of studies that show that people of color sometimes don't get the same level of treatment as relates to pain relief. Do you have any tips or any opinions on that subject?
Yeah, I do. It is true that, and it's definitely been a more popular topic of conversation about the lack of information or guidance, or thorough investigation in people of color, or poor people, and the amount of the degree of medical care that they receive. There are certain assumptions that are played into some of our medical conditions, or a lack of investigation or overwhelming nature on the healthcare provider at the time, because the people of color and financially underserved population, they're busy working, and they work blue collar jobs, and getting out from work to get to the doctor can be a significant challenge. So by the time said population arrives at the doctor's office seeking care, it can be more urgent than not. So that can sometimes prove to be a stress for the healthcare provider. And the healthcare provider may not be as thorough in going through that, or they might just go to more automatic diagnoses. So the tips I would give a person of color like myself, or somebody who doesn't see the doctor regularly and is going, I would say definitely ask a lot of questions. Read your labels. If you have any issues reading your labels or need help, do turn to a friend or a family member who can assist you in reading them. Very often, reasons not to take a medication is on the box. But if you are going to a pharmacist, there are just so many moments where they are obligated to ask you, and they will ask, do you have any questions? Take that time to utilize that moment in their skill set and in their knowledge. But I also think that if you are taking something, I think the ways that you can classify some of these things are Am I taking medication for my blood pressure? Am I taking medication for my immune health? You know, when you start to classify what the medicine or supplement you're taking is in treating your system, you can use those general words, and then the pharmacist or healthcare provider can use that to build off of and draw it out and connect the dots for you, so you don't have to do it yourself.
Thank you. That was a very thorough answer.
Any other questions? Do I have other slides, Nia? Take home points. Most important point is listen to your body. So often, our body will give us subtle signs that something isn't right. It may show up as a headache. It may show up as extreme fatigue. It may show up as nausea, numbness, or a pain. Check in with your body. First thing when you wake up, how you're feeling, how's your breathing. When you sit up in the bed versus standing, how do you feel? And then if you are eating something and it's upsetting your body, that might be a sign too that, you know, your body doesn't really like what you're putting into it and could be having a reaction. So I think it's very important to try to make sure we stay present in that respect. And if you feel different or weird, seek help right away from a healthcare provider. Next, discuss all medications with your pharmacist. They're happy to do just that. Talk with your healthcare provider before changing your medication or supplement regimen, as you don't want to go what some people will call a cold turkey or just stop some medications immediately, because you can have some signs and symptoms of withdrawal. Next. These are just a list of my resources, and I'm happy to answer any questions. If you don't want to be on video or recording, you could just stop sharing your video, but otherwise we will still continue to record.
I have a question, Timmy. It's Erica.
Hi.
From Memphis, Tennessee. I can share my video. So my question is, this is something that you talked about early on in your talk, but also that's becoming more prevalent with the pandemic, is that everyone is starting to like increase their intake of vitamins and supplements and things of that nature. Is there a such thing as too much of supplements and vitamins? And also, are there things to watch out for if there is a such thing as taking too many vitamins or supplements? Second part of that question is, are there things that interact with those that you would want to be more keen, that are the most common type of supplements that are being taken right now? Thank you.
You're welcome. Thank you. That's a wonderful question. And there is, you can take too many vitamins and they can cause specific reactions. You can take too much calcium, which can lead to stones. So if you take a calcium supplement and you ingest a lot of dairy, that can line up in your biliary tract and your kidney tract, and that can cause an infection or a problem. It can cause you, if it lines up in your kidney tract or your ureter, it can cause a ureteral stone. It can cause a kidney stone, which will require you to, the pain would be so great that you would go to the hospital. So you don't want to take too much calcium. You do just want to take a low daily dose if you go to your healthcare provider and get screened and they suggest that your dietary needs aren't supplying as much. There is also a very common thing that can happen when taking supplements is, vitamin D toxicity. So you want to be able to know that when you need to replace your vitamin D, if you need it. So they do appropriate blood work with primary care physicians to see if you need to take supplements and if your diet and practices with the sun, or if you have any issues making your own, is enough. So first, find out if you need to take the supplement. Second, see how much a physician or healthcare provider recommends. I wouldn't just go and take all of these supplements, although given our current climate, that is a lot of what we're doing, right? So I think it's important to talk to your pharmacist or use some reputable sources for your daily intake and what is ideal. I'd be happy to send some other things that you might have, some other answers about some other supplements that can be taken in excessive amounts. But it's a wonderful question, because in this day and age, as we try to keep our immune system strong, we are definitely desperate to stay safe and healthy. And in trying to do that, we can do too much and cause damage to our bodies. So I think it is great that you asked the question. And I would definitely do my due diligence, but I wouldn't just take any supplement every day, all day. I would try to find out more about a recommended dose, and if I can find out if I'm deficient, if there's tests to let me know if I'm deficient.
Thank you.
Any other questions? Well, if that is it, this concludes our talk for Kusudi International Wellness Series.